Good day. The topic for today is immunity, your first line of defense in times of crisis. These are my disclosures, and this is the outline for the talk today. We'll be dabbling into immunity and vaccination, vaccination in crisis settings, and the adult vaccination schedule. Since I'm an adult infectious diseases specialist, I will skip the pediatric vaccination schedule, but you may, of course, talk to your pediatrician for your kids. Now we'll start with this. It is really a wide-known fact that vaccines transformed public health. When national programs for vaccination were established and coordinated in the 1960s, and eventually there was high vaccine program coverage that was attained, many old diseases that killed children essentially disappeared. The World Health Organization has documented that 2 to 3 million lives are saved each year, and this is because of the immunization programs. Children less than 5 years old globally are surviving. This was in the past, many children died in that age group. Not so much unlike today. Today, you rarely hear a 5-year-old or 4-year-old, a 3-year-old, a 2-year-old dying. There is the occasional case, but in the past, the number was so much more. And if you look at that third bullet, 93 deaths per 1,000 live births in 1990 went down to 39 deaths per 1,000 live births in 2018, despite many challenges. Now, in the Philippines, we see here the reported cases of vaccine preventable diseases first. Okay, so diphtheria still up and down, measles, some upticks, and then it'll go down again. However, as you can see, pertussis has started to increase. Now, neonatal tetanus, there is a downward trend. Now, but mumps, there's an increase. Rubella, a downward trend. And then tetanus, it's basically stable. Japanese encephalitis, basically stable with an uptick in the middle, right? So now, in contrast, this slide shows the Philippine vaccination coverage trend line. If the previous slide showed the vaccine preventable diseases, this one shows how good vaccination rates have been in the Philippines over time. For BCG, that's for tuberculosis, 86% is respectable, and as you can see, the trend is okay. It's been stable. Now, of course, we want higher, but it's been stable, good enough. Now, the DTP, that's diphtheria, tetanus, pertussis vaccines. The first dose, 82%, also respectable, and the trend has been stable. However, the third dose of DTP went down to 71%. That's expected, but of course that's also means that there's still more work to be done. Hepatitis B, the Philippines, as we shall see later, is a high prevalence country for hepatitis B. And one of the the recommendations is for hepatitis B to be given within 24 hours. And that's low, 54% only, although there's been some increase, as you can see in the graph. But over time, there are 3 doses of hepatitis B, and as you can see, the third dose of hepatitis B went up to 71%. Still not respectable, but at least it is higher than the within 24 hours recommendation. Now, Haemophilus influenza B, 71%, again, not yet optimal. Measles, 80%, that is okay, but again, because it's a very contagious disease, that's usually not enough. The second dose went down as expected again. And then the pneumonia vaccine, that's the pneumococcal conjugate vaccine, second or third dose, 50+%, not a good number. All right. For polio, 82%. And then if you look at the trend, there has been an increase over time, so that's respectable. Polio, 88%. That's good. That's okay. But of course, we want polio to be eradicated. And then last, maybe I'll show the rubella containing vaccine, the first dose, 80%, and it's been stable. So yeah, room for improvement, but respectable. Now we go to a brief history of vaccination. And this is on your screen. You can see smallpox. And you can see visually it's not a good disease to have, especially for kids. And what we sometimes forget is that smallpox swept across Europe in the 17th to 18th century. Imagine, we had COVID, nothing apparent visually, physically, but smallpox was their plague at the time, and they had it much worse. Plus, there was a 29% death rate for children in London. So that's high, that's much higher than the COVID death rate. And that's why they're in the Mid East in the 1500s, and England in the 1700s, 1772, the practice of variolation came to be. Okay, so what does that mean? People will get pus, from the lesions, from the skin, the skin fluid, the skin pus, and then they would, introduce it to the skin of healthy people. And they found that in many cases that this would reduce illness, but unfortunately, because remember that's a live virus, a number of people got sick also. So that's the problem with variolation, and that's why Edward Jenner, God bless him, he discovered the early evidence for vaccination. So using cowpox, he was able to predict that vaccination using cowpox could lead to the eradication of smallpox. And by 1980, he was correct. The world was free of naturally occurring smallpox. All right. So that's one very good evidence of the benefits of vaccination. Look at the image of smallpox, and of course we say thank you that smallpox is no longer seen at this moment in time. So what is a vaccine? A vaccine is a biological product that is used to safely induce an immune response so that we will develop protection against infection. So it's a preventive measure. And the protection is measured in clinical trials. So there's a pre-trial, there's phase 1, phase 2, phase 3, and then there's post afterwards. There's still monitoring afterwards. And vaccines can be live or non-live. We mentioned that variolation used a live smallpox virus, from the pus, from the fluids. But vaccines sometimes use live also, but attenuated or weakened. But most vaccines today are actually non-live or inactivated, so killed. So they're no longer living. So they won't cause disease anymore, except for the couple of few that are live. No? And then there are new vaccines, no, such as viral vectors, nucleic acid-based RNA and DNA vaccines, such as the COVID vaccine, some of the COVID vaccines, and virus-like particles. No? So there is development. And these couple of slides I won't go into, but I just wanted to show that there are many different types of vaccine. If you can just focus on the left side, you see that there are live attenuated or weakened or inactivated vaccines. So an example are measles, mumps, rubella. No? Then the killed whole organism. So this one is a killed, so it's dead. So whole cell pertussis, polio, influenza, and the others. No? And then toxoid, some diseases are caused by toxins, not specifically by the microbe itself, but the toxins that they produce. So diphtheria and tetanus vaccines use the toxoid, a toxin that was weakened as well. No? And a subunit is a part of the virus. No? So just examples are purified proteins, recombinant protein, polysaccharides. That's a sugar-like part of the vaccine, peptides or parts of a protein. So pertussis, influenza, Hep B, meningococcal, pneumonia vaccine, typhoid, and hepatitis A are examples. And the virus-like particle, so this one is not a true virus, but they create a kind of like a virus-like structure, and that's HPV. You know? And on the rightmost side, those are the diseases for which these types of vaccines were introduced. No? Smallpox, typhoid, diphtheria, anthrax, and hepatitis B. And down the line, no? So maybe here I will just focus on the fourth row, nucleic acid vaccine, because that's the one that was introduced first, of course, rapidly developed because it was a crisis. But within a year, there was a SARS-CoV-2 vaccine that was developed. No? All right, so that really benefited us, and as we really experienced, no, after the start of the vaccination, we saw a decrease in the amount of COVID-19 that we saw in the hospitals. So how does the vaccine? How does it do it? No? So vaccines induce antibodies, and you see there the vaccine, and it induces the vaccine antigen or the whatever. It's either the killed, the inactivated, the particle, or the RNA, the RNA that is that will eventually teach the body how to produce similar looking viruses, so that the immune system will know how it looks like ahead of time. No? So what happens there is that you have the dendritic cell that will receive those antigens, and of course vaccines have adjuvants. No? Adjuvants are components of the vaccine that aid or boost the immune response. No? And that dendritic cell, the purple one, will go and interact with T cells, no? CD4 T cells. No? So these T cells are kind of like the attackers, no? The killers. So if they find a microbe, no, that the vaccine is trying to teach that this is the enemy, they will attack it. No? They're the attackers. But if you look at the middle pathway, the CD4 T cell also interacts with the B cells. Now, the B cells are the ones that that proliferate to form memory B cells. No? So meaning they are the ones that have long-term memory to know who and what is the enemy. No? Specifically what the vaccine is trying to tell them, that this is the enemy. No? And in addition to that, the B cells are eventually develop into plasma cells, and then these also have also have memory, and they can be stored in the bone marrow, uh, ready to act and produce antibodies, no, when they are needed down the line, when there's a true enemy that now comes, no. Now, going to the second part, to the last pathway, no, the T cell also produces other effector T cells, no. Okay, so that means, you know, when they're the direct, you know, they directly, when they can, also attack the microorganism or the pathogen or the enemy that comes inside the body. So, what are the features of vaccine-induced protection? Of course, the main one would be the antibodies, and of course, these the immune memory, you know, that is induced, you know, because of the vaccination. That means, again, when you are vaccinated, the vaccine is actually teaching your immune system, teaching them what the enemy looks like, so that when the enemy comes in the future, they are quicker to respond. And this protects against asymptomatic infection or colonization. But it also reduces acquisition of the pathogen, so prevention. And if someone is prevented from getting sick or getting that pathogen, that microorganism, definitely there will be reduced transmission, no? Because if I had it, for example, then I can infect someone else. But if I'm vaccinated and that vaccine response prevents me from getting sick, then the forward transmission is stopped, no? It's like pay it forward, but you do not pay the disease forward, no? And eventually, if so many people are protected, then that's herd immunity, and we shall delve in that in a bit. So, immune memory, no? So usually there, after you are vaccinated, there's a primary immune response, no? So your body learns, okay, and then afterwards the body stores that memory, right? So there's a reduction in immune response, but when you get exposed to the one that you trained for, no, then you have a stronger and quicker immune response, as you see on the left upper, no? And it's more effective in those diseases that have a longer incubation period. You know, when you say incubation period, when you get infected, you don't get sick right away. There's an amount of time that either the virus or the bacteria needs before it starts to declare itself, no? So now vaccines become more effective if there's a longer incubation period, no? Now the graph below shows that the incubation period for Haemophilus influenza, for example, is shorter, and that's why, and of course the protection is slightly less than if the incubation period is longer. However, there are some immune responses that are after vaccination that are lifelong, no? For example, yellow fever, and that's the one on the right. So that's immune memory. Now, as we mentioned, let's talk about herd immunity. You know, the blue persons on the left, no, are of course the susceptible ones. These are the ones that don't have protection because they never were vaccinated before, or they never encountered the pathogen or the enemy before, no. So in that case, if and that happened in COVID, no, if everyone is unprotected, no, if there is that first guy who gets infected, the red one, the diseased one, and no one's protected, then the pay it forward, the negative pay it forward will happen. And that's what happened in the first part of the COVID pandemic. That's why so many people got hospitalized, so many people got it, because we were unprotected at the start. Okay, so that's what happens if there is no vaccination, no protection. However, let's see what happens if there is a vaccine and people are vaccinated. However, here you see It's kind of like half, no? Half got the vaccine, half didn't get the vaccine. Okay, that's why there are some blue ones, then there are some yellow ones. The yellow ones are the vaccinated, and there are the blue ones that did not get vaccinated. No? So let's say 50-50. And then here comes the red guy, the one who has the disease. There's still an outbreak that happens. No? That is if the vaccine coverage is below the threshold, the needed percentage to achieve herd protection or herd immunity. You will still have an outbreak if you do not have if you do not achieve the correct number of people to receive vaccination or get the protective immunity. Okay, so still not good, and I hope everyone can appreciate that. However, and this is the real concept of herd immunity. Now, if you look at the yellow, most of the people are yellow on the left side. That means majority of the population was vaccinated, or at least reached the threshold, the needed percentage, the target percentage to develop herd immunity. No? And here comes the red guy again, diseased, contagious, infectious. You see that when he comes, and since there's so many protected people, the virus, the bacteria, or the pathogen, whichever it is unable to continuously transmit and infiltrate the community. So you see that. So that is the concept of herd immunity. So if you really think about it, when you protect yourself with vaccination, really it's not just an individual thing. The benefit is actually exponential if majority of the community get vaccinated and the target, the threshold for herd immunity is reached. So if you protect yourself and your family, you actually also protect the community. And this happens if majority are vaccinated. So just a couple of other things. No, herd. We said threshold or percentage of herd to reach herd immunity, and it's different for different diseases. No, for highly contagious pathogens such as measles or pertussis, 95% of the population must be vaccinated because it's very contagious. No, so you need a higher threshold and a higher target. For less contagious ones, polio, rubella, mumps, or diphtheria, it can be less than 86%, or 86 or less. No? For influenza, threshold is highly variable from season to season because influenza is really known to change. No? Sometimes more contagious than others, no, etc. And also affected by vaccine effectiveness, no? Because every year the vaccine for influenza changes. No? So based on the last strains, the scientists try to predict what would be the best things to place in the vaccine, which strains, to try and combat the coming influenza in the next year. So it's not 100% definitely. So 80% threshold or percentage target is optimal. And those in the routine vaccination schedule that we will be going through are really can cause herd immunity, except for tetanus, because that one is individual, because that's again it's not a contagious disease that is easy to get, because you get it because if you are exposed, you get wounded, and it's a dirty wound, then you can get the toxin. So another thing, in addition to herd immunity, the concept of the shadow, what does the shadow mean? Recent studies have documented that measles disease, causes a prolonged shadow over the immune system. What does this mean? It's depletion of immune memory. if you get the disease, not the vaccine. No? So if you're unvaccinated, you get the disease, the measles virus enters your body, gets you sick, and depletes the immune memory of your body. No? And therefore, you are higher risk of death from other causes, not just the measles. No? And therefore, measles vaccination reduces mortality not just from measles, but for unconnected diseases that would have occurred because of the shadow. Or the other term for the shadow is immune amnesia. So that's also one thing to think about, no? Because if you get the disease, you can get sick, and the sickness itself can affect your immunity as well. Now, there are factors that affect vaccine protection. Of course, the highest burden and mortality from infectious diseases, as we mentioned earlier, are the youngest, those the 5-year-olds and below. Of course, the youngest infants are the most affected, and of course, the elderly. No, here it says 75 years old and above, but can be 65 and above. No, and schedule of vaccination. The earlier, the better. And if you comply to the routine schedule, it's better. And especially for kids, because the kids are actually protected for 6 months, because the maternal antibodies, the antibodies from the mother, seep into them for the next 6 months after they're born. But afterwards, they lose the maternal antibodies and they are on their own. And that's when the vaccines, the antibodies from vaccination should take over from the maternal antibodies. Now we talk about safety and side effects of vaccines. No? So, it is really a widespread scientific fact, no, based on evidence, that vaccines are remarkably safe. Of course, not 100%, no, because there are common side effects. So, and this comes from safety studies. No, like I mentioned, no, when there is a vaccine that's developed, it starts from pre-trial, phase 1 trial, phase 2 trial, phase 3 trial, and then post-marketing surveillance. No, therefore, there's so much data. No, and that's based on lots of data and not just from a single case report that you heard. No, because one of your friends, reported that this happened. Okay. So this is more robust evidence. No? So safety studies usually involve 3,000 to tens of thousands of individuals. So lots of data. And the common side effects are really just minor, no? Just those related to the stick, no? Injection site pain, redness, swelling, fever, malaise or weakness, and headache, no? So minor, no? However, we should remember that for those who are T-cell deficient, remember we talked about T-cells and they had a role in how antibodies will eventually be formed, no? And how the B cells will eventually be called into action, no? So the T-cell, if a person has T-cell deficiency, the live vaccines should be avoided. And of course, there are the significant rare side effects, and this knowledge we know because of the safety studies themselves, no? But they're very low. Anaphylaxis, 1 in a million. Idiopathic thrombocytopenic purpura or ITP, 1 in 24,000 after a measles vaccine, not all vaccines. And therefore, after, you really have to weigh the benefits over the risks, no? Especially consider what the disease can do to you, no? So if the benefits outweigh the risks, then you get it. And the overwhelming medical analysis, scientific analysis show that benefits do outweigh the risks because of the massive reductions in disease. Okay, and that means a lot of decreased deaths, a lot of decreased hospitalizations from serious illnesses. No? And then continuing vaccine safety assessment post-licensure, of course, continues to occur. And now we move on to immunization during armed conflict and crisis settings, just because, because of the war in the Middle East right now. No? So the problem with crisis settings will be, first, delivery is more complex and fragile, more difficult in these conflict-affected settings. Definitely, there will be disruption of health systems, and because people move around, forced to move around, there's a reshaping of disease dynamics. No, some of course refugees will of course come together more closely than what is supposed to be, in camps, and that reshapes disease dynamics, making it easier for illnesses to be transmitted. Therefore, increase in outbreaks and, of course, worse health outcomes because of easy acquisition of the disease, more difficult management because the setting is not ideal, and it affects us also. We're not in the war, but because of the war, there's disruption of supply, etc., and then therefore there's also some disruption of health system that leaks to our setting now. And paradoxically, for those in those crisis setting, those settings are the ones where immunization is most needed. Now, immunity is, of course, very important in fragile settings. Look at that picture. No, that's what I was talking about when I said the setting is now not ideal. No, water is not as readily available for hand washing. No, your water might not be as clean as you would want. No, you are closer to other people than what is recommended, and therefore you are at risk for poorer health outcomes. And therefore, herd immunity is essential to prevent infectious diseases outbreaks, especially in this setting. But also in our setting, that doesn't remove the fact that we also need herd immunity. They just need it more. No? And therefore, protection relies on high vaccine coverage. In crisis and conflict settings, this is difficult because when immunization vaccination is disrupted, there will be immunity gaps and vaccine preventable illnesses resurface, which is sad. And of course, declining immunity during conflict. No, Ethiopia, as an example, 39% of infants missed essential vaccinations, and even during the COVID-19 pandemic, I'm pretty sure there was a reduction in essential vaccinations. No? And there was disruption of immunization services, increased outbreaks such as measles, polio. They are making comebacks. No? And maternal and child services, including vaccination, were reduced or unavailable. Again, that happened in the COVID-19 pandemic, at least initially. And all the above leads to a growing population of unvaccinated individuals, particularly children, and herd immunity breaks down. Now let's examine the mechanisms of immunity breakdown. So first is, of course, interruption of routine vaccination. As we said, this is due to facility destruction, lack of healthcare workers, supply shortages, and that can affect us, no? And then missed childhood immunization windows, and therefore children remain susceptible and catch-up vaccination becomes more difficult. And then reduced booster coverage lowers the overall immunity. And of course, malnutrition, no? Hopefully it doesn't happen to us, no? If supply, hopefully we don't have problems with supply with food, no, etc. And hopefully that will not weaken our immune response. And of course, if we are malnourished, our and immunity is affected, this reduces vaccine effectiveness. Now let's look at some vaccination strategies in crisis settings. Now, of course, right now we're talking about the Middle East, but we did experience these during the COVID-19 crisis that we had. No? So mass vaccination campaigns for rapid immunity, very important. To contain the outbreak rapidly, important. And of course, mobile and outreach services, no? Mobile clinics, community health workers going around, no? And during the COVID-19 pandemic, vaccination was done in malls, no, etc. And of course, prioritization of high-risk groups, which actually also was done during the COVID-19 pandemic and is now needed in Middle East. So because they have higher susceptibility, they have greater risk of severe disease. Now, of course, vaccine technology pushes forward or marches on. No? And the mRNA technology that was used in the COVID-19 pandemic, no, uh, was very useful at that time because of the rapid development, flexibility, and targeting pathogens, and the high efficacy, no, 90+%, no. And although there are limitations, especially in crisis settings, no, they need ultra cold storage, no? And the distribution is logistically complex because of the cold chain. They need to maintain the proper cold chain during transport. And lastly, we saw also in COVID that there were global systems and collaborations that supported vaccination, and that's why it was really so good. Now, we talked about herd immunity. One person, one person and his or her family, if they get vaccinated, will help the community, especially if majority of the community also do the same thing, no? But in this case, global systems, no? So there was COVAX, and we heard that in the news, no? This was a global vaccine sharing system under WHO, Gavi, and CEPI. Of course, WHO, we know, World Health Organization, the global leadership in public health. They made the vaccination guidelines, they coordinated with the others, and Gavi, the Vaccine Alliance, was in charge of vaccine access distribution in low resource settings, and they actually co-led COVAX. And then the Coalition for Epidemic Preparedness Innovations, or CEPI, their focus is vaccine development for emerging diseases, no? And IVI strengthens vaccine production capacity in developing countries. So again, this one is, if we talked about individuals helping the community, this one are global organizations helping the globe or the world. And this is the last part, no? The adult immunization schedule by age 19 to 65 and above, no? And usually we use the PSMID immunization schedule, the Philippine Society for Microbiology and Infectious Diseases. But as of now, no, it's undergoing update, and that's why let me use the CDC, which is also very reliable, of course, no? And we start with COVID-19, no? Although the problem these days is we don't have the COVID-19 vaccine anymore. So, just to give you an insight, the other countries west in the US, they still have the COVID-19 vaccine. We don't have anymore, no? But they still have a vaccination schedule. But since we don't have it, I won't discuss that anymore. Influenza is needed annually, so once a year, okay, for 6 months and beyond, 6 months old and beyond and older, so all of us, essentially. So just to give you the lay of the land for this this graph, no, if it's yellow, it's recommended, okay. If it's purple, okay, it's it can be given depending on the indication. There's special indications, special circumstances when it's given, no? So, for example, the inactivated and recombinant influenza annually, 1 dose. But for the second type, it's purple, so it's not universally recommended. Now, to stop a bit, no, I just wanted to show the effects of COVID-19 versus the effects of, people think, what are the complications of the vaccine, no? The problem is, when you answer that question, you need to understand that the disease itself actually has higher complications than the vaccine itself. That's why benefits outweigh the risks, no? And COVID, of course, is a primarily pulmonary or respiratory illness, no? So cough, colds, sore throat, fever, but sometimes, and many times, especially at the start, when there was no protection yet, it would develop into difficulty breathing, so acute respiratory distress syndrome early on. Sometimes even failure of your breathing. That means you'll need a tube in and a ventilator. But there are long-term complications such as shortness of breath for months or years, no? Oxygen dependence, no? Scarring of your lungs, no? The decline of the function of your respiration, no? That happens, no? But there are other organs that can be affected, like the central nervous system, no? So encephalopathy, Guillain-Barré syndrome, these are affectations of the central nervous system, and even long term, no, loss of smell, loss of taste, no, again Guillain-Barré syndrome, no. Now compare that to the complications of COVID-19 vaccines. Very, very, very rare, no. Bell's palsy, less than 1%, 0.00 something, no. Guillain-Barré is also 0.00, meaning very, very low, no. 1 in millions, no. The heart, no, COVID-19 affects the heart in many ways, no. Abnormal rhythms, myocardial injury, meaning heart attack can occur, no? Heart failure, shock, no. Myocarditis or swelling of the heart muscle, no. Okay. But if you compare that to the COVID-19 vaccine complications, myocarditis can occur, or can be, or was reported, but again very, very minimal, 1 in millions, 0.000 something, no. And even the blood, no. COVID-19 was really known to cause blood clotting, no? Strokes, heart attacks, no. Clots in the lung, no. But the vaccine is also, there have been reports that there were some also blood clots, but again, very, very, very low, no. As I computed that for you, no? Influenza as well, no. When you get influenza, you can get hospitalized, no? Especially for the high risk, no? So the black bars show high hospitalization compared to the low risk people, no? So high risk are the very young, the very old, those with comorbid conditions, medical conditions, those who have weak immune systems, the pregnant women, no? So and shown here on the right side are the vaccine effectiveness. Of course, we have to say that the vaccines are not 100% effective, no? In general, we say 40 to 60, no? In preventing illness, you can still get it, but it's actually even better at preventing severe illness, so that those high risk patients in black, no, the number of them that will become hospitalized if they are vaccinated will go down. And now we go to RSV, no, respiratory syncytial virus, no. It's not for everyone except for the yellow one, see, 75 years old and above, but it is given for at least one pregnancy, no. And again, special circumstances, no. Tetanus, diphtheria, and pertussis. This is the adult booster, no. It's for everyone, as you can see. It's yellow, 1 dose, then every 10 years. Okay. Measles, mumps, rubella is for everyone, no, until 65 years old, no. 1 to 2 doses depending on indication, and if born 1957 or later, no. And varicella, 2 doses if born 1980 or later, because if you were born earlier, you're considered already, you had chickenpox, and therefore you have some protection already. So RSV is another respiratory illness, no, and it's one of the main killers of our infants, no, and young people, no. And of course, it also it can kill those who have pulmonary illness already, no. So, and this one, you see the many RSV complications, no. All right, so pneumonia and down the line, no. And compare that, of course, those are life-threatening conditions. But if you look at the common complications or side effects, no, they're just injection site pains, no, some redness, no, headaches, no. So again, the benefits really outweigh the risks. Now, tetanus, diphtheria, pertussis, we mentioned this before. The one on the lowest, the picture on the lowest, that's a sign of a full-blown tetanus, no? So all the muscles are all spastic, no? And it can even break the bones, no, the spine, no? So that's how tetanus is very important, no, to be protected from, no? And of course, diphtheria is the one on the left upper. You have that pseudomembrane on the throat. Of course, very bad coughing, no? Of course, worse for our young ones, no? And of course, diphtheria, no? The whooping cough, no? So here we see that Tdap is very effective, no? The tetanus part, almost everyone is protected for about 10 years. Diphtheria, 95% effective for about 10 years. And pertussis, about 70% effective in the first year, although it goes down, no? And it's very safe, no? Measles, mumps, and rubella, this is how it looks. Actually, measles and rubella may look the same except for some features that we can see in the mouth, no? Of course, mumps, we know, is swelling on one side, the parotid gland, no? And here we see the two-dose efficacy, 97% effective against measles, MMR, 86% effective against mumps. So another important thing about MMR, which includes rubella, no, is the rubella vaccination part, no? And as you can see there, there's a pregnant woman, it says X, but the non-pregnant woman, there's a check, no? That means this vaccine is very important for the non-pregnant and one who hopes to become pregnant in the future or might become pregnant in the future, no? Because there's such a thing called the rubella syndrome. So if you get pregnant and you get this rubella, there's a chance that your kid might get microcephaly, so small skull, small brain, PDA or patent ductus arteriosus. So there are certain holes in the heart, and even cataract. So the baby will be unable to see properly, no? So that is one thing that can also be prevented with rubella vaccination. Now, it's a live virus, so the pregnant lady, when she's already pregnant, cannot get it. Okay. Now, zoster recombinant is the shingles vaccine, so it's more recommended for 50 years old and above. HPV from 9, usually as early as 9 to 26 years old, but here it's just shown 19 to 26 because we're just focused on adult vaccination. And of course, pneumonia vaccine, and you can see it's more for the 50 and above. So I'm not discussing anymore the special indications, okay? But talk to your doctor. And this is how shingles looks, okay? So it's like chickenpox. It is chickenpox that came back, but not whole body anymore, just one side. But it can become very painful. And vaccination is over 90% effective at preventing both the shingles itself and the pain that can occur because of the shingles. All right. So of course, those who have high risk, who have weak immune systems, may get the vaccine as well. And again, studies show that Shingrix is safe, and in clinical trials, Shingrix was not associated with serious adverse events. HPV. Here are the numbers based on CDC. HPV vaccine decreases infections 56 to 88%, 81% in 20 to 24%. That's very good. Reduces chances of anogenital warts by 61% in the young females, 44% in the 20 to 24 year olds. No? And then cervical pre-cancers, because HPV can cause cancer. No? 50% lower in the 18 to 20 year olds, 36% lower in the 20 and 24%. And it's very safe except for the rare serious allergy. And of course, the pneumonia vaccine. It offers protection from severe infections. It's most critical for babies under 2, adults over 65, although like we mentioned earlier, as early as 50, you can get the pneumonia vaccine or other indications, those who have comorbidities, etc. Remember that it protects not just from pneumonia, but also from meningitis, bacteremia, or bloodstream infection, sepsis. 95% of deaths related to pneumococcal disease are in older adults, and their chances of severe infections reduced by 75%. Now that picture is Dr. Sabin from the Sabin Vaccine Institute. The Sabin Vaccine Institute was named after him. These ones I will not go through. Talk to your doctor about whether you are eligible for the pneumonia vaccine and which pneumonia vaccine. And then, of course, hepatitis A, B, meningococcal vaccines, no? Depends on the indication, no? Except for hepatitis B, especially for us in the Philippines, no? Very important for us. That's why they're yellow. Of course, Haemophilus influenza B, a respiratory infection, Mpox. But polio is definitely yellow and needs to be given if you have not gotten it, no? Especially for kids, no? But here, let's look at hepatitis A. We are included in the high rates of hepatitis A in the world. So the Philippines has high Hep A rates. So we need the Hep A vaccine. We are on the red, so that's high prevalence for hepatitis B again. Unfortunately, the Philippines has high prevalence for chronic hepatitis B. Now, fortunately, meningococcus, of course, meningitis, meningococcal meningitis is not high in the Philippines. No, we're not in the belt. No. Just to end, this is basically the same, but now focusing on specific illnesses. So, if you have specific conditions, not specifically illnesses, conditions like pregnancy, HIV, you don't have a spleen, you have a complement deficiency, you have heart or lung disease, etc., you will have specific indications or recommendations for vaccination. Okay, so that's how it looks. No, I don't need to go through the nitty-gritty details. Talk to your doctor on what vaccines you would need based on what conditions you have. All right, so we'll go to the next slide. So these are the general contraindications and precautions. Of course, if you have a severe reaction from a vaccine component in the past, you cannot get it again. There are precautions. Talk to your doctor about it, especially if you have a moderate or severe acute illness that is ongoing. Now, the rule of thumb is if you cannot remember, you can get the vaccine again. And you don't need to restart or add doses to vaccine series for extended intervals between doses. So now, in summary, okay, vaccines transformed public health by reducing diseases. We saw, based on the data, vaccines really saved lives. Reduced illnesses, saved lives. Now, how do vaccines work? Vaccines produce antibodies with memory. And therefore, when the infection tries to enter, it prevents infection. And once prevention of infection occurs, there's prevention of transmission. And if a lot of people do this, herd immunity occurs. That means your individual protection, when many do it, there is herd immunity. And vaccination in crisis settings, naturally there will be immunization disruption, causing gaps in immunity, and therefore what resurfaces? Vaccine preventable illnesses. And of course, we went through the adult vaccination schedule by age, of course, and also we mentioned that if you have medical conditions or specific conditions, you may have additional recommendations. So talk to your doctor about it. So thank you so much. I just wanted to inform everyone that during the COVID-19 pandemic, I came out with 3 books, Microbial Maliit, Pandemyang Pasakit 1 and 2, and Mini Microbe, Painful Pandemic. That's the English translation of the first book. And it has a website, if you can check it out. And I have posted this lecture there, and many different other lectures that you can go through. Check the YouTube site. It's at Mini Microbio Books, or Microbial Maliit Mini Microbe. And just in case you are interested, I also have a Letters of Paul to the Philippines YouTube channel wherein every Sunday, I make reflections. Of course, try to proclaim a little bit the word of God, but at the same time, you know, discuss reflections about it. And the last one was follow the voice the shepherd calls to us. And I tried to make it as relatable as possible. In this case, I related it to the movie um, Dead Poet Society, and of course sometimes other things that are applicable to us, like the Middle East crisis, but a biblical response to it. All right, so thank you so much for your attention, and hope to see you sometime.